Ready for disasters. Disaster preparedness education. Be prepared. Step 1. Make a kit. When preparing for a possible emergency situation, it is best to brainstorm on the basics for survival, such as water, food, battery-powered or hand-crank radio, an NOAA weather radio with tone alert, flashlight and extra batteries, first aid kit, whistle, dust masks, plastic sheeting and duct tape, moist towelettes, garbage bags and plastic ties for personal sanitation, wrench or pliers to turn off utilities, a can opener for food, local maps, and your cell phone along with your chargers. Food and water. Each individual should have a gallon of water each day for hydration and sanitation. It is vital that each person have a 3-day supply of water, which is best stored in clean plastic containers such as soft drink bottles. Each person should also have a 3-day food supply ready and prepared. Food should require little or no refrigeration, preparation, or cooking and/or water. Pack utensils and a manual can opener. Food should contain very little salt, as salt can cause dehydration and loss of water. Foods can include ready-to-eat canned meats, fruits and vegetables, protein bars, dry cereal or granola, peanut butter, dried fruit, nuts, crackers, canned juices, non-perishable pasteurized milk, high-energy foods, vitamins, food for infants, and/or comfort or stress foods. Clean air. Potential emergencies such as floods can release bacteria like airborne mold and mildew. Explosions may release very fine debris very harmful to the lungs. Certain germs can make you ill if inhaled or absorbed through open cuts. Consider a portable air purifier with a high-efficiency particulate air filtration or HEPA filter to help remove contaminants from the room where you are sheltering. These highly efficient filters have small sieves that can capture very tiny particles, including some biological agents. Once trapped within a HEPA filter, contaminants cannot get into your body and make you sick. Shelter in place. A shelter in place is composed of and needs heavyweight plastic garbage bags or plastic sheeting, duct tape, and scissors. Tape up the windows, doors, and air vents. If you need to seal off a room from outside contamination, consider cutting and labeling these materials beforehand. Anything you can do in advance will save time when it counts. First aid kit. During an emergency, individuals may suffer burns, cuts, and other injuries. Many injuries are not life-threatening and do not require your immediate attention. Taking first aid teaches how to treat minor injuries. By having the following things, you can stop bleeding, prevent infection, and assist in decontamination. Things to include are 2 pairs of latex or sterile gloves, sterile dressings to stop bleeding, a cleansing agent or soap and antibiotic towelettes to disinfect, antibiotic ointment to prevent infection, burn ointment to prevent infection, adhesive bandages in a variety of sizes, eye wash solution to flush the eyes or as a general decontaminant, thermometer, prescription medications you take every day such as insulin, heart medicine, and asthma inhalers, and the prescribed medical supplies such as glucose and blood pressure monitoring equipment and supplies. Pet care. Your pet is an important member of your household. Some of the things you can do to prepare for the unexpected, such as assembling an animal emergency supply kit and developing a pet care buddy system, are the same for any emergency. If you must evacuate, take your pets with you if possible. However, you are going to a public shelter, it is important to understand that animals may not be allowed inside. Make a backup emergency plan in case you can't care for your animals yourself. Develop a buddy system with neighbors, friends, and relatives to make sure that someone is available to care for or evacuate your pets if you are unable to do so. Step 2. Make a plan. Your family may not be together when disaster strikes, making it important to plan in advance on making contact or regrouping. Identify an out-of-town contact. It may be easier to make a long-distance phone call than to call across town, so an out-of-town contact may be a better position to communicate among separated family members. Be sure every member of your family knows the cell phone number and has the cell phone coins or a prepaid phone card to call the emergency contact. If you have a cell phone, program that person as the ICE in case of emergency in your phone. If you are in an accident, emergency personnel will often check your ICE listings in order to get a hold of someone you know. Teach family members how to use text messaging. Text messages often can get around network disruptions when a phone call might not be able to get through. Deciding whether to stay or go. Staying. Bring your family and pets inside. Lock doors, close windows, air vents, and fireplace dampers. Turn off fans, air conditioning, and forced air heating systems. Take your emergency supply kit unless you have reason to believe it has been contaminated. Go into the interior room with filled windows if possible. Seal all windows, doors, and air vents with plastic sheeting and duct tape. Consider measuring and cutting the sheetings in advance to save time. Be prepared to improvise and use what you have to seal gaps so that you create a barrier between yourself and any contamination. Local authorities may not immediately be able to provide information. Neighborhoods and apartments. A community working together during an emergency makes sense. Talk to your neighbors about how you can work together during an emergency. Find out if anyone has specialized equipment, like a power generator or expertise such as medical knowledge that might help in a crisis. Decide who will check on elderly or disabled neighbors. Make backup plans for children in case you can't get home in an emergency. Sharing and communicating in advance is a good strategy. In a moving vehicle. If there is an explosion or the vehicle is difficult to control, pull over, stop the car, and set the parking brake. Avoid overpasses, bridges, power lines, signs, and other hazards. If a power line falls on your car, you are at risk of electrical shock. Stay inside until a trained person removes the wire. Listen to the radio for information and instructions as they become available. Step 3. Be informed. Things you can do to prepare. Making an emergency supply kit. Developing a family communications plan. Learn more about potential emergencies that could happen where you live. Learn how to respond to them. Learn about the emergency plans that have been established in your area by your state and local government. Floods. The most common natural disasters today are known as floods. Familiarize yourself with these terms to help identify a flood hazard. Flood watch, flash flood watch, flood warning, and flash flood warning. Prepare your home. Find out if your home is at risk for flood and educate yourself on the impact a flood could have on you and your family. Elevate the furnace, water heater, and electrical panel in your home if you live in an area that has a high flood risk. Consider installing check valves to prevent flood water from backing up into the drains of your home. Be ready, be prepared, be aware. I would like to thank you all for taking the time and initiative in coming out to this presentation. If you have any questions, please feel free to ask them now. Once again, thank you and have a great day. The Medical Reserve Corps thanks you.